Let's talk about how area agencies on aging, or AAAs, coordinate health and supportive services. Housing instability in all its forms can negatively affect one's health. Whether it's difficulty paying rent, overcrowding living conditions, eviction, or homelessness, having stable housing can support an individual's need to address their mental and physical health. Services to improve housing stability and address other health-related social needs are delivered in the home and in the community to prevent falls, address food insecurity and transportation issues, manage chronic disease, support employment and economic independence, reduce social isolation, and address other non-medical risk factors. Addressing health-related social needs has been shown to improve health outcomes and reduce the cost of care. Healthcare systems are increasingly looking for effective ways to integrate these services into traditional healthcare. As the local leaders on aging well at home and in the community, area agencies on aging have long addressed the social determinants of health by providing home and community-based services. Today, many AAAs provide a variety of services through healthcare contracts to address health-related social needs. AAAs contract with traditional Medicaid and Medicaid managed care programs, Department of Veterans Affairs and VA medical centers, commercial and employer-sponsored health plans, and others to provide services that address health-related social needs. The most common services provided through healthcare contracts by AAAs are assessment or screening for social determinant of health needs, such as food security, safe and affordable housing, and access to reliable transportation, ongoing case management or care coordination, nutrition programs, assessment for long-term services and supports eligibility, and home care and other personal assistance provided in the home to support an older adult's ability to age well. Through these contracts, AAAs also support people with complex care needs, such as people who have cancer, dementia, behavioral health disorders, housing instability, or other complicated situations. Often these individuals are at high risk for emergency department use, hospitalization, and hospital readmissions. Their health or other living conditions may put them at high risk of becoming homeless or moving to a nursing home. A growing number of AAAs are creating formal networks with their partners and other community-based organizations to make it easier to contract with healthcare entities. These networks help streamline the contracting process for their healthcare partners and increase their own geographic reach. Many of these networks are spearheaded by AAAs, but they also could be led by other community-based organizations. That community care hub or network lead entity serves as the contract holder or network administrator. This model allows community-based organizations of all types to collaborate, which leverages the breadth of expertise and services in that community in a way that enhances coordination for providers, payers, and patients. AAA's involvement in these community care hubs improves access to home and community-based services needed to thrive in the community. Looking to help older adults age in place safely with independence and access to resources in their communities? If you know your local AAA, give them a call or visit their website. Find the AAA nearest you by contacting the Elder Care Locator by calling 800-677-1116. You can also find your local AAA by zip code or city and state by visiting eldercare.acl.gov and entering your zip code or city or state in the text box that appears at the top of the homepage. This video was brought to you by the Housing and Services Resource Center, or HSRC. which is a joint initiative between the U.S. Department of Health and Human Services and the U.S. Department of Housing and Urban Development. The HSRC fosters collaboration and partnerships between the organizations and systems that work to help people live successfully and stably in the community. The HSRC is led by the Administration for Community Living.